hurricanes, fires, and floods, testing the endurance of devastated communities, and inspiring acts of courage from those who came to help. For pharmacists and pharmacy technicians in the path of these disasters, courage meant preparing for the worst, innovating as they dealt with the unanticipated, and caring for patients until they could once again care for themselves. When Hurricane Michael roared into the Florida Panhandle, the Department of Veterans Affairs Emergency Pharmacy Service was ready. Mobile pharmacy units, staffed by volunteers from across the country, filled more than 1,000 prescriptions to those in need and dispensed analgesics to veterans injured during the storm. At HCA Healthcare, emergency planning and activation has become the new normal. When Hurricane Michael heavily damaged its Panama City Gulf Coast Medical Center, patients were evacuated. But careful planning by HCA management kept the emergency department open and ensured medication and supplies were delivered by any means possible: plane, helicopter, and even amphibious vehicles. Flooding from Hurricane Florence isolated several North Carolina communities for days. Despite threats to their own homes and families, pharmacy staff at Carolina East Medical Center, Conway Medical Center, New Hanover Regional Medical Center, and Novant Health Brunswick Medical Center remained at their posts for up to a week, ensuring that both patients and local residents had access to crucial medications. As supplies ran low, new deliveries were loaded into law enforcement vehicles or rerouted numerous times to reach the medical centers on the surrounding flooded roads. In California, pharmacists and technicians selflessly put the needs of patients before their own, even as deadly blazes endangered their homes and families. Pharmacy staff from Kaiser Permanente and Adventist Health Feather River jumped into action to facilitate the relocation of patients and medical supplies and aid in the immediate recovery efforts, providing both compassion and care to those displaced by the fires, even in the face of their own personal losses. Well after Hurricane Maria struck in September of 2018, pharmacists continued to provide important and courageous support to both colleagues on the front lines and residents slowly recovering from the storm. This included sorting through supplies to ensure that the medications hastily donated in the immediate aftermath of the storm were readily available to those who desperately needed them. For the pharmacy staff at Mercy Hospital and Medical Center, courage has meant simply continuing on. In the face of unbelievable loss, they honor their fallen colleagues by providing the best care to their patients each day. The pharmacists and technicians that we honor today set a standard for our profession. In times of extreme need, as well as during our daily practice, to provide care driven by courage to support the health of our patients, our colleagues, and our communities.